I'm going to use this tuning fork,
Okay.
and I'm going to hit it, and I'm going to place it on the top of your head, and I want you to let me know if you can hear it, okay?
Yes.
Okay, great. And now I'm going to hit it, and I'm going to put it behind your ear, and I want you to first tell me if you can hear it, okay? And then tell me when the sound goes away.
Okay.
I'm going to put it on this mastoid process. Can you hear that?
Yes.
Okay. And say now when it goes away.
Okay.
Okay. Can you hear that?
Mhm.
Say now when it goes away.
Okay.
Perfect. We're going to do that on the same, on the other side. Can you hear it?
Mm-hmm. Okay.
Okay. Can you hear it?
Mm-hmm. Okay.
Okay, great. Now I'm going to take a look in your ears. Just a second as I switch this out. And that last test was testing cranial nerve 8, the acoustic nerve. And with your eyes, when I had you looking in the different directions, I was checking cranial nerves 3, the oculomotor, 4, the trochlear, and 6, the abducens, just to make sure that your eye muscles were moving appropriately.
Okay.
Okay. And this can be a little bit uncomfortable too.
Mhm.
It can tickle a little bit, but I'll be very careful not to touch the inner
Okay.
canal. So I'm going to pull back and just go in, and the ear canal is pink but not red and inflamed. And actually going to rest. There we go. Okay, and your tympanic membrane is nice and a pearly color. I don't see any redness or inflammation or bulging. That's exactly what we're about to see. I'm sorry, I know that. I know that makes it tickle. And now we're going to look in this ear here. Okay, do the same thing. Okay. And same here, just a little bit of earwax, which is normal, and also a normal tympanic membrane on that side. Very good. Okay. And now I'm going to look at your nose.
Okay.
And as I look, would you like to put your glasses back on? You can. As I look, I see that his nose is symmetrical. I don't see any lesions or sores on his nose, and I'm just going to palpate. It's nice and soft. The cartilage is flexible. I'm going to look in your nose. I'm just going to pull up a little bit and note that the septum is midline and not deviated. And as I look in, his turbinates are not inflamed or swollen or boggy. There's no sign of infection, no drainage, no bogginess there, no redness. can you press on one and sniff, and press on the other and sniff? So his nares are clear. Okay, and now I'm gonna look at your mouth. I note that his lips are not dry or cracked. They're moist. They're of appropriate color. Okay. Oh, you can leave your glasses on if you like. Can you open your mouth for me? Okay. And I'm assessing the oral mucosa, and it's pink and moist. I don't see any lesions in his oral mucosa. I'm just gonna bring your lip down a little bit. His gums are pink and not inflamed. His teeth are intact. Okay. Can you say ah for me? Good. His uvula is midline and not swollen. Have you gotten your tonsils out?
Yes.
Okay, because I do not notice any tonsils. Can you stick your tongue out for me? Okay, and can you raise your tongue up? No lesions noted on the bottom of his oral cavity or under his tongue. The tongue is strong and midline, which signifies an intact cranial nerve 12, which is the hypoglossal nerve. Okay. And when he said the soft palate moved up, which signifies an intact cranial nerve, glossopharyngeal. So that's very good. So far everything is looking just like we want it to look. Okay, I'm going to look at your neck now, okay? As I look at Mr. Otey's neck, I don't see any obvious swelling or masses. I'm going to check your trachea to make sure it's midline. Might tickle a little bit. Trachea is midline with no evidence of any tugging. Can you swallow for me? Good. That also shows an intact vagus nerve. And I also had him do that so that I could feel where his thyroid gland is. I'm going to kind of push that to the side. Can you swallow again for me? And as he swallows, I'm feeling for any nodules or masses. And then push to the side again. Can you swallow again for me, sir? Good. And I'm not feeling any masses or nodules on his thyroid gland. I want to do range of motion for your neck. Can you look up at that light for me? And look down, kind of touch your chin. Look over your right shoulder and your left shoulder. Wonderful. And can you press against my hand? Good. And press against this hand. Good. So we have full range of motion in the neck and is able to press against pressure, so that shows an intact sternomastoid muscle and trapeze muscle.
So everything looks okay?
It does. I've already checked your supraclavicular nodes and was not able to palpate that. And I do need to palpate your carotid pulses. And I'm going to do these one at a time, because I don't want to occlude all of the blood flow to your brain. That wouldn't be a good thing. Carotid pulses are palpable. And if you'll sit there for just a second, I'm going to go get my stethoscope because I want to listen to that also.
Okay.
If I had a bell on my stethoscope, I would use the bell to assess the carotids for bruits. Can you hold your breath for me for just a second? Okay, you can breathe. And hold your breath again. And you can breathe. No bruits noted in the carotids. Okay. Okay, Mr. Otey, that completes the exam.
Okay.
Everything was normal.
Mhm.
I didn't feel anything abnormal when I looked at
Mhm.
your head or your face or your scalp.
Mhm.
Your pupils are reactive. I can see the light reflex in your eyes, which is good. And your vision, your corrected vision.
Mhm.
I don't have my glasses on. You just put my glasses on. Is 20/30.
Mm.
Okay. Your hearing seems fine with bone conduction and air conduction, and you were able to hear from through the air longer than bone, which is normal.
Mhm.
I didn't feel any abnormal lymph nodes,
Okay.
and your throat, no masses on your thyroid, no lesions or anything in your mouth, and so you've had a very normal exam.
Okay.
Do you have any questions for me?
No, you were very clever.
Well, thank you, and I appreciate your time.
Okay.
Okay, thank you.
Mhm.